Hi, my name is Carly McFarland, and this is my capstone presentation on teaching nurses how to teach. So currently I am a senior here at the University of Mount Union. I'm in the nursing program to receive my Bachelor's of Science in Nursing. I am expected to graduate in May of 2023, and then I can take my NCLEX and receive my RN so that I can start working in the hospitals. I also have the opportunity of working as a nurse tech at Salem Hospital, and within my clinical experience and my work experience at Salem, I'm in charge of stripping down the rooms and making sure that they're clean and ready for the next patient to be admitted into that room. And a lot of times what I'm finding in the hospital is that I'm throwing out patient education that the patient was supposed to take home with them and look over and understand in order for them to not be readmitted to the hospital or to provide them with resources that they may need in the community. So my focus community that I will be talking about in this presentation is nursing students and active RNs in the hospital that may be giving this patient education. And we want to increase the health literacy of our patients by providing them with good and accurate education in the hospitals. So what is the problem? The problem is that nurses aren't given this formal education on educating our patients. So it's hard for us to fit that into our schedule and to properly educate our patients when there's no teaching being done to us. In the Nephrology Nursing Journal, there's an informational piece written by Beth Ulich called Teaching Nurses to Teach. This source proposes the problem that nurses do not receive this training to teach their patients while they're in nursing school. So Ulrich states that, like nursing, teaching also requires focused practice in order to attain mastery. So teaching itself is its own specific set of skills. That's why there's a whole major dedicated to it. That's why you can get a degree specifically in public health education. However, nurses are expected to learn all of the core and fundamental elements of nursing and the pathophysiology and the med surge behind everything, but they're also expected to provide that education because we are the ones in the hospital that do the discharge teaching. We're also the ones in the hospital that spend the most time with these patients. So the nurses need to have a good understanding of health literacy and education literacy in order to provide this patient education. So a little bit deeper into the problem, I chose 3 different things to focus on. So nursing students lack education on education, therefore readmission rates are increased. However, there's also barriers within the hospital that would prevent health and discharge education from happening. So in the BMC nursing website, there's an open access website that contains peer-reviewed journals on nursing topics. There's a study done by T. Mungatar and V. Marika in 2022 titled Nursing Students' Understanding of Health Literacy and Health Practices. So this article focuses on the inadequacies of health literacy amongst members of the hospital and how this can negatively impact the direct care that's provided to them. So it's basically concluding that nursing students have a good understanding of this health literacy, but more effort needs to be applied to maintain their understanding during and beyond their point of graduation. So we need to not only teach these nurses how to teach in school, but we need to provide continuing education opportunities in the hospitals for practicing RNs to be able to catch up on their skills and learn new skills on teaching or different sets of skills they may have to do in the hospital. So this lack of nursing education on education contributes to readmission rates of patients within the hospital because the patients aren't receiving education, so they're being readmitted to the hospital for the same things that they were previously in the hospital for because they're not preventing anything from happening because they're not reading or being taught how to take care of themselves when they're out of the hospital. So we need to start combating the curriculum to prepare them for this. So there's also different barriers within the hospital that may prevent a discharge or education from happening. So barriers within the hospital would be interpersonal role ambiguity, low prioritization of education, and high patient to staffing ratios. So in the Journal of Nursing Management, which is combined with the Oncology Nursing Forum, there's a qualitative study done by MC and SG called Miss Nursing Care in Patient Education. This study surveyed 8 of 35 nurses on patient education and the need for readmission due to post-operative complications from lack of education. So this role ambiguity between the levels of nurses is concerning for the patient education because nurses and doctors aren't communicating with each other, so nobody knows who's actually providing the education for the patient. Everyone just assumes somebody else will do it. So relating to this interpersonal role ambiguity, there is a study posted by the Mayo Clinic Cancer Center, written by Kay Negley and more, that talks about the need for interprofessional communication throughout the hospital. He performs a study where volunteers from a hospital carry out a collaboration project in order to facilitate patient education amongst chemotherapy. So Negley's results concluded from the feedback of the volunteers that establishing and building an interprofessional collaboration will promote patient education that goes into play throughout the whole hospital. So back to the bigger picture of the barriers. Looking at an article I mentioned earlier by T. Mungatir and V. Marika in the BMC website, it states that the good understanding of health literacy of nursing students is not supported by good health practices, which can send conflicting messages to their patients. So nursing students need to have this backbone of a health literacy in order to become good nurses. And if they're in the hospital and they're trying to provide education and they can't do it, the patient starts to distrust them, and it can ultimately lead to a bad nurse-to-patient ratio or relationship, and it diminishes the ability for the nurse to teach them and for the patient to absorb that information. Not only is there a low prioritization of health education literacy within the nursing school curriculum, there's low prioritization of health education from nurse to patients. So back to a study I mentioned earlier by M. Chi and S. Chi called Miss Nursing Care in Patient Education. It states that not priority nursing care for patient education is due to competing work demands and missing the workplace culture to teach. So high nursing staff ratios are going to make it harder for the nurse to prioritize this education because more patients per nurse means that each nurse is spending less time with each patient. So on the grand scheme of their priority list in the workplace for the things that they need to get done, education falls last because they're giving meds, or they're wrapping wounds, or they're assessing somebody that's just come in, or getting vitals. They need to be doing other things on the floor instead of educating their patients, which is not good. This study also promotes the use of informal teaching that the nurse can carry out conversationally during nursing care activities. So being able to cluster care and provide education while you're in the room giving care will contribute to better, more patient education being provided when you have a high patient to staffing ratio. However, a lot of times the information is not absorbed as well because you're doing it quickly and a patient may not be in the mental mindset to receive that information. So this is a graph from a study done by F. Hagedorus, V. Bogart, and K. Meester. It's collected from the BMC Health Service website, and it's an observational study called The Impact of Nurse Staffing Levels and Nurses' Education on Patient Mortality in Medical and Surgical Wards. So the numbers at the bottom are the ward numbers, and the numbers across the side are the mean nursing hours per patient day. The green dots would be the optimal amount of hours you would want to have, and the open dots are the actual numbers on those wards of hours that are being spent with each patient. As you can see, the patient should be receiving a lot more hours with each nurse than they actually are. So this is just contributing to the high patient to staff ratios because education is going to fall on the bottom of the priority list every single time. So raising health literacy. Solutions to this problem correlate to increasing educational courses on education. Within a study done by F. Ventura and Green in the Journal for Nurses for Professional Development, they run a trial with volunteer nurses from the hospital to take education courses on the Teach Back method. The study basically concluded that clinical nurses who attended the pilot program were highly motivated and displayed an intention to change behavior regarding their patient education. So nurses want to fix this problem. If they're given the opportunity in the hospital to take a skills workshop or take a study that will increase their patient care, they're going to do it. On Science Direct's website, within the Journal of Patient Education and Counseling, there's a research workshop called Teaching Nurses How to Teach, done by G. Laminelli and A. Fury. This workshop also provides workshops on patient education for the nurses, and this study also concluded that trainings based on patient-centered models and interactive learning models should be implemented for nurses to improve their education. So incorporating this technology that we have in the hospitals for pamphlets and videos and presentations that we can show the patient in order to provide them good care. Another source by Wolters Kluwer, which is a company that produces resources for nursing students. Mount Union does a great job at using them. They posted on their website 5 strategies for providing effective patient education. So you want to take advantage of this technology that's being made, and you want to not just hand the patient the stack of papers, but go through the information with them, and you want to make sure that they understand it and make sure that they're learning it in order to increase their health literacy. So the nursing curriculum needs to change, and Mount Union does a great job at incorporating education into our curriculum. However, a lot of places do not do that. So nurses are struggling to teach these patients, which leads to bad outcomes and higher readmission rates. Thank you. And here are my sources.